Hi, good night, everybody. How are you? Can you listen to me clearly?
Yes.
Okay, perfect. Well, 8 and 5, it's your choice. Do you want to start now or do you prefer to wait for a little bit?
Good night, teacher. I think if the class is too long, I think we should start now.
Okay, let me share a screen and then we can start. So let's go. Let me see. Can you watch my screen?
Yes.
Perfect, the yellow one. Well, we have 2 weeks for relaxing time, I think. It was necessarily. But now let's go again with all the material we have to check. We only have 3 weeks to cover all the material that is from this module 2. So let's keep on studying, keep on reading. I think this time you were practicing, so you know how we work. And you know that at the end of the Zoom session, I'm gonna upload the slides to the Zoom chat. But if the signal is failing or something is going wrong, we're going to correct it, okay? And please pay attention because in a similar way than previous weeks, I'm gonna call anybody for answering me or for reading or something like that, okay? So let's go. Well, tonight we are going to talk about treatment. I mean, a general view what a treatment means, and some important elements, some important details that we must know. We're going to consider the medical treatment and the surgical treatment. I mean, not as a specific indication when to choose something like that or criteria, because it's indeed our medical career or healthcare providers, right? But I'm gonna show you details that could be useful, details that are important to take in account, to consider, and a very, very general view about therapies in order to take in account some expressions and specific vocabulary that could be indeed this context. So taking this in account, let's go ahead. Talking about the medical treatment, of course, we all know, got the idea what it means. But checking the definition, of course, we have to consider this is the management and care of a patient to combat a disease or disorder. And well, we must take in account that medical treatment includes all treatment not otherwise excluded, using prescription medications. I mean, not all the drugs are for prescriptions, for medical prescription, right? But the ones that are into this context, of course, have some rules to be sent. We're going to check it in the next slides. Using prescription medication or use of a non-prescription drug at prescription strength. The non-prescription drugs, we're checking a few details in the module 1. When you can go to a supermarket and buy a specific medication, I mean, an aspirin maybe in a low doses, or paracetamol in a low doses in the standard one. Well, details like that, I mean, not very non-controlled or not antibiotics, non-controlled drugs, I mean. Using wound closing devices such as surgical glues, sutures, and staples, of course, are included into treatments. Using any devices with rigid stays or other systems designed to immobilize parts of the body. We were checking this on model 1 again, just for considering this, for example, the cast or the splint. And the administration of oxygen to treat injury or illness. Okay, so take it into account. And there are some exclusions from definition of medical treatment, of course. Not everything is treatment. Medical treatment excludes the following items: observation or counseling, visits to a physician or other licensed healthcare professional solely for observation or counseling. I mean, if I go to the emergency room because, well, it's by experience, because very common in elderlies, they said, I want to talk with somebody. What? I need to talk. Please hear me. I'm alone. I don't have anybody to talk with. And they go to the medical services in order to feel that they still have company. Just that they take 15 minutes to talk about anything, to consider themselves useful at this point, not feeling alone. That's not treatment. Sometimes they go and they have nothing. In real, they are not with illness, they are without any trouble, but they start acting that they feel something wrong. Is because looking for attention. We have to be so humans and understand that that kind of situation is not easy to deal with. So it's not a medical treatment, but we have to try to help that kind of situations, right? Diagnostic procedures, of course, are not treatment. And well, this is the conduct of diagnostic procedures such as X-rays or blood tests, including the administration of prescription medication used solely for diagnostic purposes. I mean, the eye drops to dilate pupils that we were talking in the previous classes, of course, are not treatment. And first aid, when you go to take assistance to a patient on the street, is not a treatment. As its name says, first aid, you are studying the procedures, the protocols, you are trying to control a situation, but you are not bringing a treatment as a fact. Okay, you only give a support until getting into the hospital, until being admitted in the emergency room maybe, or in the place that is designed for you. And then with the second evaluation, the doctor on duty is going to decide what kind of treatment do you really need. In first aid, you go, control the situation, pick up the patient, and go to the hospital. That's all. You stabilize the patient, but you don't give a specific diagnosis. Sometimes it's obvious, but we need to support it by medical investigation, as we were talking in previous slides, right, in previous classes. Talking about medical treatment specifically, we have the classifications, the 3 ways to divide it: the curative, palliative, and preventative. Curative, of course, to cure a patient of an illness. We can use antibiotics, we can use any other kind of drugs in order to control an illness, right? Palliative, to relieve symptoms from an illness, such as cancer or a disease, right? Such as cancer, or to control pain, I mean, palliative treatment in order to make the situation easier to deal with. And preventative, the best one, I think, because we have the chance to avoid the onset of an illness, or, well, to control the community in order to avoid risk, to give information, give knowledge in order to as it says, preventative, to make prevention about lots of situations that we already know at this point. Of course, when we are talking about medical treatment, surgical treatment, anything like that, we must consider the prescription, the drugs, the medical prescription. Sometimes we can read medical prescription versus medical receipt. They are not the same. They are completely different. Medical prescription is that indication of the doctor when you receive the name of the drug, the doses, well, everything about how to take a pill or something like that. The medical recipe, well, actually, recipe is for cooking. That's why it's not correct. If you hear medical recipe, it's a mistake. It's not the properly way to talk about. Always medical prescription, okay? So taking it in account, as a part of treatment, a doctor may prescribe medication, commonly referred as medicine or drugs, of course. And a prescription may take these forms. In the old style, we were used to write down by handwriting, I mean, with our awful way of handwriting, not clearly, but we had the chance to send the presentation tablets, the name of the drug, and the milligrams, right? The frequency, how many tablets is going to receive the patient, and how they have to be taken. I mean, 2 tabs every night, right? But there are some research, some articles that support that while writing, like using handwriting, it was not easy for some drug sellers from pharmacists to read properly, and there were mistakes while giving the medical prescription to the patient, or maybe reading the abbreviations. That's why through the time it's changing to printed medical prescriptions. In the new style, following the countries like UK, USA, well, Europe in general, Canada, you have to send your medical prescription printed and following the correct order of everything. If you compare the old style and the new style, there are small differences, but they are clearly, for example, nocte, it's an old term, but now we just send at night. These differences, of course, help patients to understand and avoid that mistakes. Of course, we don't make mistakes with the drugs, with medication. So considering this, we have again this slide, and we can check. In UK specifically, the patients take prescriptions to a chemist's shop. Okay, a drugstore in USA is a chemist shop. So, which sells a wide range of non-prescription medicines and other products such as cosmetics. Okay, the chemists usually send by free, well, without recipe, without medical prescription, the non-controlled medication like paracetamol, but in small doses and in small quantity. I mean, no more than 10 tabs. And well, aspirin no more than 5, for example. Well, cosmetics in general, okay, or for dispensing by a pharmacist, well, is the one in that country is the one who prepares, who creates that medicines or that formulas. In hospitals, into the hospitals, I mean, prescriptions are dispensed by the pharmacy, the department where the drugs are prepared, are sold, and everything. Okay, pharmacy is similar to Spanish, I think. And the drugstore is for chemist shops, as it could be a synonym, right? The medical recipe and the medical prescription, well, I think it's clear the difference. Well, the medical prescription goes in this way. A common prescription might include these 8 details. 1, the prescriber the information and signature from the doctor, the patient information, the date prescription, and when the medical prescription was written, of course. The superscription holds the RX. That's the symbol we always check in medical prescriptions, and it means take though you take or receive, not receive, and let me correct it, previously send it to you, receive. The inscription is the medication prescribed, the subscription, the dispensing instruction to the pharmacist. So it's a detail for the pharmacist just. The sign up, the given direction or instruction to the patient, and the special instructions according to the situation. They can send some special instructions, okay? So taking this information in count, we can check these examples. We have our 8 details, if you can compare them. The number of the doctor, the location, well, everything. The patient, location, age, and data, right? Medication, of course, well, it's better to use the chemical name, I mean the formula, not the commercial name. That's the way to do it. The number, how many, in this case, suppositories you're sending to the patient, and how it's going to be sent. Here we have an example with abbreviations. Again, in this prescription, we have again abbreviations. They are so common in USA and UK. That's why they can send with abbreviations in the prescription, and it's easy for people to understand. If it's not clear, the pharmacist is going to show the meaning of this. Then you have here the signature and the codes, the professional codes, the signature again, and the refill. And though, I mean, in USA, in UK, in some places in Europe, you have the chance to use the same medical prescription to buy as well for no more than 5 times the same prescription. I mean, from this copper got, the patient has no chance for refilling again. In some situations, patients have numbers in this place where it says refill 1, 2, 3, 4, 5 by numbers. And the pharmacist just check the number, places the date when the patient is buying the new prescription, and then while finishing, they can go again with the same medical prescription and do it. When this is though, it means complete, yeah. It's complete, yes, and everything. So it means that when patient finishes buying the medication as many times as the doctor said, it's full, they don't have a chance to buy it again. They have to go again to the doctor. It's a possible way to find it. It's faster, I think. You don't have to go every time to collect a new medical prescription, but that's the way to do it. It's very similar to Spanish. I think while the medical career, the career we are taking, we are studying, we have the chance to learn how to prepare this document, because it's a document, of course, it has legal purposes. And well, it's the same, very, very similar to Spanish. And there are some abbreviations, the most common ones that I found that I prepared for you. Word or phrase you have in Latin, the abbreviation and the meaning. Why in Latin? It's the same situation with anatomical parts. Doctors, all the old ones, love to make a mess talking in Latin, so we only have to study this and practice. So you have, for example, bis in die, twice a day. right? Very common. Caps, capsula, capsule, comps, compositus, or compounded, come. The C with this, I'm not sure about this grammatical detail, but it's like a hat, right? With, we were checking this in previous slides, in previous class. We have it, very common while reading, and its end. It, of course, is without an abbreviation, that's why we read it. For example, Orazón HS, very common at bedtime, or PO by mouth, or per oral, or per os. PRN, very common when necessary. Prorata, so take it in count. Wow, quartering die, very common liquid. Quartering die, as you know, 4 times daily. The signa, right. The stats, very common in Spanish. Statim, it means immediately. The teeth, yeah, tearing die, 3 times daily. So you can check. Easy to make while practicing, but well, we have to check these 2 charts in order to practice and try to memorize all of them. We have our blue guy, so it's showing us that it's very important slide. Going ahead, well, talking specifically about the way that nowadays the medical prescription is done, the British National Formulary has a very good way to show the most important information to the patient. I mean, when you receive, for example, like this, sulconazole nitrate for a treatment, with the medication, you receive a small piece of paper showing the most important information. I mean, it's not fulfilled by the doctor. It's the pharmacist is going to give it to the patient in order to be alert if something is going different or is going with the side effect or something like that. The only detail that the pharmacist feels are the dose to apply, how the doctor explain the patient the way to use the medication. So check this practice in order to reach in vocabulary, and consider that it's very useful. Sometimes the side effects can be confused with another pathology when certainly we are having trouble with the medication, with the drug that we are using. And as you know, no matter how many times you use a specific medication, now could be the chance to suffer the side effect or allergy about this. So you also give in this chart the laboratory that is developing the medication and the commercial name, right? Just as an extra information, it's important to take it in count. Now I have some details, the black and words to consider and practice with. So we have an indication is a situation or sign that suggests a specific treatment should be given, right? A contraindication is a situation or sign that a specific drug or treatment should not be used or is contraindicated. Of course, we all know about it. Check this. Exelderm registered is a proprietary, is a commercial name. We all know about it. For a medication containing sulconazole nitrate. The same drug may have both proprietary's name and a generic name. The generic name we all know is the sulconazole nitrate. Again, another example, the Prozac is fluoxetine, and the proprietary and generic names for the same drug. We all know these 2 names for just one medication. We decide which one we can use during our practice. Okay. Talking about surgical treatment, as a general view, I mean, we must consider some details. Diego, can you hear me? Okay.
Yeah, teacher. Yeah.
Okay,
Sorry.
don't worry, Diego. Can you read this slide, please?
Yeah, teacher. Sorry. Sure. Well, surgical treatment is a medical procedure involving an incision with instruments performed to repair damage or arrest disease in a living body. Surgery is an invasive technique with fundamental principle of physical intervention on organ systems, tissues, for diagnostic or therapeutic reasons. As a general rule, a procedure is considered surgical when it involves cutting of a person's tissues or closure of a previously sustained wound.
Thank you so much, Diego. So
You're
you can
welcome.
see, yeah, thank you. Or you can see the surgical treatment. We all know what it means. We all know how it works. We have a specific protocols to follow in order to be in that kind of procedures. Nobody wants to be in the operating room as a patient, but when it happens, when it's necessary, we must get into. The operating theater. Well, actually, operating theater is an old, very old definition, we can say, the old name of the surgical room. Why is operating theater? When surgery was in the process of being studied and developing, I mean, 100 years ago could be, or something like that. Actually, there was a theater when surgeries were developed. I mean, you have the stairs rounding the edge with the surgical table, surgical bed, in order to take the patient and the surgeon with one nurse and the second surgeon is commonly the student, the pupil of the surgeon. We're going into we're going with the patient to the surgical theater in the middle of the theater, and they were developing the procedure. So in the stairs, all doctors who wanted to learn how to perform surgery had the chance to check and to see, like a theater moment, how was it going? I mean, you had the chance to check in a living moment, the live stream, I mean, yeah, with all of the stress of the moment, how this procedure was developed. And usually patients died. Some of them were surviving and were taking notes and studying like this. That's why it's operating theater. Nowadays, we know that it's not possible to make it because we have surgical rooms, of course, very, very clean and very controlled areas with temperature controlled, with cleaning, very deep clean areas, sterile, everything is sterile, I mean, in order to protect the patient, because we are getting into the body, right? And that way we have to consider that operating theater is just the way we have to use this in order to follow our history, medical history, right? Pamela, can you hear me? Pamela?
Yes.
Thank you. Thank you. Can you read this slide, please?
The operating theater. Surgery is carried out in an operating theater. Great care is taken to make sure that operations take place in sterile conditions, free from microorganisms. The surgeon and his or her assistant wash or scrub up abundant surgical gowns, masks, and gloves. The patient's skin is prepared by disinfecting it with an antiseptic solution. This is known as prepping, preparing the patient. They are then covered with sterile wraps so that only the area of the operation is exposed.
Thank you so much, Pamela. So you can see in this paragraph, in this prescription, in this description, these sterile conditions are so controlled. I mean, you cannot go into with long nails or painted nails. You have to be clear that it's done in order to be free from bugs or microorganisms to protect our patient. To use surgical gowns, masks, gloves, to prepare the patient has a protocol, has some rules to follow and to control in order to ensure that everything is ready. I mean, skin and everything like that. Please give me a minute. Okay, I'm sorry. I think my baby was crying, but no, it was a false alarm. I'm sorry. It's not going to happen again. So, taking this in account, this information, check again the vocabulary in black and words in order to practice. Okay. Let's go ahead. In this picture, we can check a surgeon with all the clothings, with the scrub, complete scrub, in order to get ready into the operating room and prepare the patient and start the operation, right? The surgical cap, surgical mask, the surgical gown, the surgical gloves, the surgical shoe cover. As a group, all of this stuff is called a scrub, okay? I'm showing you this. Okay, wash or scrub up. I mean, when we say scrub up, I mean we get dressed like this, right? Now checking the most common instruments, the basic ones. We have the plain thumb forceps. The picture is clear. The rat tooth or thumb tissue forceps, again. Forceps are for these devices, pinzas, I mean. Plain thumb, rat tooth tissue or rat tooth thumb tissue. The curved mosquito hemostat. Okay, you can check the difference and how it goes, right? The Crail hemostatic forceps. The Crail has a different shape in the point. You can see the line one and the curved one. The Kosher or Ochsner hemostatic forceps. You can see Kosher is similar to the rat tooth. It's for catching tissues again, hard tissues, we can say. The needle holder, of course, it has groove to hold needle in the jaws. This line, this is the groove. This line for making extra pressure into the needle holder. Okay. The towel clamp, you can see it's for catching the dresses. I mean, all the material that is going to be on the patient. Okay, the Mayo Higer needle holders again with the groove, a new groove. The Alice tissue forceps, we all know that the difference in the points in the forceps, I mean. The Backhound's tower clamps again. The scalpel holder, again, we all know how to prepare this. The sharp or sharp scissors for dissecting tissues. The both blade tips are sharp, you know. Then we have the Mayo dissecting scissors, this one, and the Betzenbaum for soft tissues, we can say. The curved blunt or blunt scissors, okay. We have the suture scissors. You can see it's different shape on the scissors, the blunt. The sharp blunt scissors again. You can see with a sharp point, the blunt, two blunt points. The Lister bandage scissors. We know that it's for Lister bandages because of this rolled point, yes, detail, yeah. This detail is for protecting the skin, for bringing safety to the patient, for not cutting the skin, not making mistakes, right? And as a general detail, we can say that we have blades or jaws when we compare. We have the joint, we have the shack, the finger rings handle, ratchet. I mean, we know how to place, how to catch these instruments, and how to catch the needle and the suture, right? Then we have the retracting and exposing instruments. We have the valvas, the diver, the perivalve, we will know about. The diver is, well, we know it's manual for opening or retract deep abdominal or chest incisions for moving lots of structures, yeah. The valve 4, it's amazing. It's great to place this in abdomen and thorax, of course. And now let's go to the operation. Please practice the instruments. Check the functions that are described, but just for giving extra information, we're going to make a very general review of this during homework, okay? Talking about the operation as a fact, of course, we have some vocabulary to consider, to take in count, okay? And Neil, can you hear me?
Yes.
Thank you. Can you read, please, this slide?
Okay. The operation. Wait. The operation begins when the surgeon makes an incision or cut. Control of bleeding is very important. A swab is a part of cotton of other material used to soak up blood from the operation site. A sucker is a mechanical device with aspirated, sucks up blood, bleeding vessels and tight ups.
Okay, thank you. And sucks up blood. Neil?
Yes. Blood bleeding vessels and tight the ligatures or sealed by an electronic current. Diathermy.
Yeah, diathermy. Maybe you had a chance to see that sometimes while cutting, the surgeon or doctor uses a device that looks like a pencil and pushing, well, it has two buttons. You push one button and this provides a cut, and you push the other button and it provides the electronic, an electronic discharge, and you make a ligature, I mean. That's a diathermy. I'm gonna find a picture to show to the group in the WhatsApp group. It's gonna be easier. Well, following the operation, the procedure as a fact, that was the way that was reading Neil. It starts with the doctor makes the incision, makes the cut, And well, controls the bleeding. That's the most important part, to control the bleeding of all of the structures. Then using the swab is that cotton block, we can say, when you can collect the blood from the patient, and according how many blood you take from this, well, into this swab, you can infer how many blood is losing the patient, and you have to make better control. Of course, you have the sucker aspirates everything, and you can collect all the blood or fluids from the patient and control all of this situation, right? According to that, you know how the operation is going on. Please consider all of this, practice. Tomorrow we can talk about it during the workshop. Let's see these details. We have drains. The drains are these tubes, these details that go into the wound, into the body. Drains may be inserted to carry away fluid, which might act as a culture medium of bacteria. All of drains are placed during the surgical procedure, of course, at the end, in order to take out liquids for avoiding that cultures, for avoiding that bacteria growing. Various methods are used to close the wound. I mean, we can get sutures like this, also known as stitches. We can use sterile strips, not very common, it's just for skin that is without stress, or staples. The staples are nowadays one of the best ways to do it because they don't have the same pressure as sutures, the same, they don't give skin the chance to get inflamed, I mean, to get swelled. In order, staples are easier to control. Finally, we can see the wound is covered by this dressing, the big one. The dressing is usually by gauze, and well, we can control that the drain is working because we have a part of this by frame, and we can check how the fluids are going out, right? Well, the operation report is just for checking vocabulary, okay? The black and words. So following this example is just for vocabulary. So we are not going to write an operation report, of course, but we have to consider this specific vocabulary for practicing, okay? We had a patient who had an indirect right inguinal hernia. The anesthesia, spinal anesthetic with local anesthetic infiltration. The incision, right inguinal, okay? The procedure. Let me see who's going to be the bunny. Carla, can you hear me? 1, 2, 3. Yeah. Okay, Carla. Carla, your microphone is open, but I cannot hear you. Okay, don't worry. Andrea, can you hear me?
Yes, I can hear you, Miss.
Okay, thank you. Can you read the procedure, please?
Okay. The external oblique aponeurosis was divided and the spermatic cord mobilized. The hernial sac was identified and separated from the spermatic cord. The hernial sac was then mobilized back to its neck, where it was transfixed and the redundant tissue excised. The fascia at the neck of the spermatic cord was divided, carefully preserving the vessels. The genital branch of the vas deferens. Thereafter, the posterior of the anal canal was repaired in 2 layers. Closure, the wound was closed in layers with Dexon suture material to the external oblique aponeurosis and staples to the skin.
Thank you, Andrea. Thank you so much. So you can see this specific vocabulary. Practice on this. take it in mind because we are going to use this at the moment with homework or during the final test, okay? So take it in count. The redundant tissue size, repaired, preserving, closed in layers, very important, okay? Sometimes we have to close in layers lots of wounds that are not usually going to the surgical room. For example, in a limb, I mean, in a leg, we had a cut that is not taking a risk. We can clean it up with lots of solutions. We can use antibiotics. And we have to suture this to close in layers, right? Considering its characteristics, we choose the suture, the correct one. It's easy, it's nice. Let's talk about radiotherapy and chemotherapy. Just a general view because we had a chance to see some details in previous classes. Now we are going to see some extra details that can complete the previous information with this one, okay? Radiotherapy is the use of radiation in controlled doses to treat cancers. Many types of cancers, we all know about it. It works by damaging the DNA of malignant cells, and of course, the normal cells too. Radiotherapy may be used as curative treatment, for example, to shrink tumors, as adjuvant treatment alongside of following chemotherapy, treatment with anti-cancer drugs, or in lower doses as palliative treatment to reduce pain and other symptoms of cancer or disease, but not as a cure because they are terminal. We all know about it. Just a general view of this to consider. We have this specialist, the radiologist. This doctor is the one who determines the dose and the exact target of the radiation beams. Dosage is measured by grays, GY. A daily dose is a fraction, right? Radiotherapy can also be delivered internally by radioactive implants, such as needles, or by liquids, such as strontium or some bone cancers. So this information is important to take into account. For example, we have the seeds. It's used for prostatic cancer, and that's the way how we place it in the perineum of the patient in order to send the radioactive source or radioactive dosage all the time in order to control the situation. According to this, the seeds, these implants, can be curative or palliative, well, according to the dosage and how many times they have to stay into the body. In the way they get into their place, that's the same way they have to be taken out. How does radiotherapy work? Well, we all know this. It's just an extra slide. We have the external beam radiotherapy, and we have the brachytherapy. And we get into, for example, in a lung tumor, lung cancer, we get into with the bronchoscope. Then we get to the esophagus and trachea. Well, we get into the trachea actually. And with the catheter, we send the radioactive source and tumor. We usually freeze the tumor and take out in a full piece, right? A full one just as a block. And that's a way to consider the treatment nowadays in order to make it easier and non-invasive, well, not a surgical procedure as a big fact, when we can provide lots of complications, or we can help to spread, to prepare the metastasis of that kind of cancer. That's a good way to do it. The brachytherapy, according to the tumor, well, it's possible to apply. And well, as a general view, we have to consider the day in the life of a physiotherapist, the physios, that healthcare providers that certainly are very important for us. So without physios, of course, treatments are not complete. We don't have the chance to help patients in a properly way because we have to catch the fourth step into the treatment stages, we can say. The fourth one is the rehabilitation, the longest one, I mean. In this case, we are talking about Sam. Sam is a hospital physio, and she's working with patients who have conditions or injuries that affect lower extremities, such as fractures, torn ligaments, and cartilage tears. So usually physiotherapists work with referrals, I mean from other departments in her hospital that send the patient to Sam, and she has a chance to work with patients in rehabilitation, following orthopedic surgery, following the objectives that the treatment was applied. Some patients are young people with sport injuries. Other patients are elderly people who have had a hip replacement. Or, well, Sam has the chance to prepare or to develop her therapies by manipulation, massages, exercise to keep joints mobile and to strengthen muscles. Rehabilitation or rehabilitating some patients means helping them to walk again using crutches or Zimmer frames. You remember them, right? The crutches and the Zimmer, we got them in previous slides. But then check this again, the crutches and the Zimmer frames, the burritos, yeah. So following this, physios have the chance to help patients to recover a very important part of their lives, helping them to move by their own, to recover, well, to live that process of receiving again that capabilities of movement, right? And a very important, very important kind of treatment is the cognitive and behavioral therapy. Sometimes it's dismissed, sometimes we don't take it in count properly because we think that, well, mental status is not, at this point, is not the most important part, but actually it's necessary to take it in count. The cognitive behavioral therapy, or the CBT, is one of the talking therapies for mental health conditions. Not always considered as a pathology, of course, but we as the healthcare providers, we have the chance to see that something is not going okay, not going wrong. I don't know, something is different from the common rules. We have to be alert and then ask for help. Because, well, it's not easy to deal with these situations. Misael, can you hear me?
Yeah, I can hear.
Thank you. Can you read this slide, please?
Yeah. Cognitive behavioral therapy. Cognitive behavioral therapy is one of the talking therapies of mental health conditions. It aims to eliminate negative thoughts and change behavior in response to these thoughts. It can help with anxiety, panic attacks, depressive disorder, post-traumatic stress disorder, and chronic fatigue. Therapy can be provided in face-to-face sessions with a therapist, but delivered by computer can also be effective. It is more effective than counseling for some and can provide long-term protection against replace a return of symptoms after improvement. However, patients must be committed to solving their problems and prepared to work on them between sessions.
Thank you so much, Misael. Thank you. So you can see in model 1, we have the chance to talk about psychiatric disorders. I mean, schizophrenia, depression, many things like that, right? And the CBT was a pillar of this, but now we have an idea how it could help our patient. Anxiety, panic attacks, depressive disorders in general, post-traumatic stress disorders, chronic fatigue, all of them are focused on this kind of interventions. And using the face-to-face sessions is helpful with some kind of patients, but for other ones it's better to use the internet connection, I mean, by Zoom or Meet, well, I don't know. And, well, could be a counseling way to do it because of this kind of disorders. Sometimes it's not possible to leave home. I mean, it's not easy to do it. Of course, they take a long term, as Misael was reading. It's a long-term treatment. It's a long-term protection against relapse. So consider this as a good way to start the intervention for our patients in order to make our job in a good way. Usually for understanding the situation, the therapist gives you some homework, some activities to prepare during the, to prepare by yourself during the period you are not getting in touch, and you go with results and evaluate the results and treat a new situation or details from the situation that at the moment is being on treatment, right? It's nice, I think, if you have the chance to do it. Well, helping therapy is not always easy to recognize that you really need it, right? So let's keep this in mind from Nisa Panwar. If you have choices, choose the best. If you have no choice, do your best. Always do your best. Always, always. You are doing your best. Well, continue. Thank you. Yeah. Let's keep on working. Let's keep on reading. Let's keep on memorizing vocabulary. And of course, lots of new abbreviations, right? Okay. So let me send you the poll to take attendance. We are 11. Okay. Can you watch the poll?
Yes.
Perfect. Please fill the poll and, well, it's going to be the attendance. You know how it works. But I need one more. All of you can watch the poll. Thank you. I'm uploading the file to the chat. Give a minute, it's taking more time than I was expecting, but it's possible to make it. Okay, it's not uploading. Okay, Misael, I'm gonna send it, don't worry. I'm sending the poll again. Okay, can you watch it, Misael? I don't know. Okay, thank you. I'm gonna close this. Yes, perfect, Michelle. It's taking more time than I was expecting to upload it. Let's do this. I'm gonna send it by WhatsApp, okay? Because it's not uploading. I'm sorry, it's my internet connection. So give me a minute to send it to the one by one to the group, to the to you, the ones who were into the class, and that's all, okay? Hello, can you hear me?
Yes, we got it,
Teacher is
teacher.
okay.
Okay, thank you. So we can leave. Give me some minutes. I'm gonna send, following the attendance, all the presentations to your personal WhatsApp, okay? The slides, don't worry about it.
Okay, good night.
Good night. I'm gonna send, of course, the workshop role in some minutes too, in order to be ready tomorrow, okay?
Okay, teacher, thank you. Bye.
Okay, bye-bye, Diego. Bye-bye.